Now, South Africa's COVID-19 cases have passed the 500,000 mark, but over 68% of those have recovered, more than 342,000 people. What's contributing to the high recovery rate, though? Francesca Conradie from the Clinical HIV Research Unit at Wits University unpacks this with us. Very good morning, Francesca. Thank you so much for joining us. What can we attribute this to?
Good morning, and thanks for the opportunity to speak. So I think the first thing that you've got to do when you say the number of patients recovering is you need to decide how we define the word recovery. And in the South African context, the way that we've decided to define recovery from COVID is, first of all, you have to have a positive COVID test. You have to be free from fever for at least 3 consecutive days. So that means you're not taking Panado to settle down your fever. And your symptoms need to abate, and we look at 7 days after the onset of symptoms. And if all those things hold true, we declare a patient to be recovered. So that's how we've made the decision. Other countries have made the decision on declaring recovery slightly differently. For example, in the States, the CDC requests that we have at least 2 nasal swabs to confirm eradication of the virus. We made a decision a long time ago not to do that because, first of all, it would be using a precious resource of a test, and people who are better are recovered. So that's how we made the decision. So why do we have such an incredibly high rate? It's creeping up every day. The first thing is I think that there is a range of pathology that presents with COVID, from no symptoms at all to really severe enough symptoms to warrant admission to ICU. And it's in that highest group that we are starting to see progress on the medical front. There are 2 things that I think have contributed to the recovery of the patients who are really, really sick. One is that we've started early introduction of the use of oxygen. That sounds pretty basic, but people who have COVID, we call them, it's a weird term, so forgive me for saying it, but we call them happy hypoxics. Hypoxics means your blood level of oxygen is low, and they don't look particularly distressed. But we measure the oxygen level by simply putting a little probe on their finger. And if we find a happy hypoxic, we quickly put them onto oxygen and then upscale the oxygen as required to maintain a correct oxygen saturation level of above 94%. So that's the aggressive use of oxygen. And then we've even adopted the use of a form of oxygen called high-flow nasal oxygen, which is a step down from ventilation. So that's helping less people die. So and the next thing that we've done is, just let me finish this quick one, I'm sorry, is that we've started to use a drug, a very old-fashioned drug called dexamethasone. It's a cortisone preparation, and it's shown to reduce mortality in ICU by about 30%. So we started to use that routinely. So it means that people who got really sick now have a better chance of survival.
Now, we know that people who get the virus, the coronavirus, experience, most people, mild symptoms. I sort of talk about the herd immunity. When we look at the certain numbers, we're getting to 68% now. What happens when we get to 70, 75% recovery rate? Firstly, does that mean we're getting anywhere closer to herd immunity? And also, from a layman's point of view, at that stage, are we still calling this a pandemic if 70 to 75% of the people who get infected are recovering from it?
So a pandemic refers to the number of cases, not the outcome of the cases. So even if 100% of us got it, it would still be a pandemic.
Okay.
So we're still learning quite a lot about the immunity that you get to coronavirus. It appears that the worse you get it, the better your immune response is, and the longer lasting it is. Both the antibodies and the cell-mediated response seems to confer a longer lasting protection against the virus. Probably for every 1 case that we diagnose, there are 5 cases who are undiagnosed because they are either very mildly symptomatic or not symptomatic at all. So even that would push our recovery rate quite a lot higher if we put into that group people who didn't know that they even had it. So what about herd immunity? Are we getting close? Not quite yet, because we don't know how long that immunity lasts. But even if you have 6 to 8 weeks of immunity in the middle of a pandemic, then that will probably be enough for the response for the surge to start to decline. But please, when I say fellow South Africans, I am imitating our president. This is a very serious disease. And the only real thing that we have to protect ourselves is what we've always had, which is universal facial masking. When you're out in public, you must have something on your face. Please don't stand close next to each other unless you know that person and you are in fact living with that person. No hugging, no kissing, and please regularly wash your hands. This is not over. There are glimmers of light. There's hope that we're getting to the end of it. But we still need to continue with the adoption of non-pharmaceutical interventions.
Let's talk about that, the glimmers of light that you talk about. And one of those is, of course, everyone's waiting for news of a vaccine. But also there's research and studies that are coming out that the coronavirus antibodies, they fade away within weeks and months. Is that something we should worry about? There's also reports of T cells and also it's white blood cells. They also assist to fight the virus.
Yeah. So any form of antibody response or immunity over a period of time, even if it is transient, will help to control the virus. While you've said that our antibody response wanes, there have only been 2 or 3 documented cases when a person got corona twice. So they got it once and then they got it again. And so I think let's be a little bit, let's not be concerned about the levels of the antibodies. The vaccine is getting close, and even an imperfect vaccine, so a vaccine that is safe and works 50 to 60% of the time, that would halt this epidemic. It doesn't have to be 100% perfect. It just needs to be safe.
Okay. All right. Thank you so much for clarifying a few things for us there.